Welcome to the PS Dental Podcast, where we discuss dentist stories from their paths to dentistry to their lessons along the way. I'm your host, Ryan McGarvey, the proud son of a dentist. Today, we're speaking with Dr. Maura Pezzulla, a 2024 graduate of the University of Pennsylvania School of Dental Medicine. Distinguished by her academic achievement, Dr. Pezzulla received honors in serving vulnerable populations, reflecting her commitment to providing compassionate care to underserved communities. Listen as Dr. Pezzulla discusses the profound impact of positive dental experiences in her childhood, the importance of mentorship, and her passion for building strong patient relationships. She also provides a glimpse into her work with vulnerable populations, the decision to join the Navy, and her aspirations for the future. With strong mentorship, significant clinical experiences, and a clear vision for her career, Dr. Maura Pezzulla is poised to make a meaningful impact in dentistry. It was awesome for me to catch up with my friend Maura, and I think you're going to love her energy as much as I do. Without further ado, the newly minted Maura Pezzulla, DMD. Welcome to the PS Dental Podcast. We're here with Dr. Maura Pezzulla. How are you today, Dr. Maura?
I'm great. Thank you for the great introduction. It's definitely weird to hear doctor in front of my name, but I'm happy to be here.
Beautiful. Well, we're so happy to have you. Obviously, we have a connection given that you were a dental intern for my mom a few moons back, and you've gone on to recently graduate dental school from the University of Pennsylvania. Congratulations to you. How do you feel?
Thank you. I feel amazing. It honestly flew by. It was probably the most challenging thing I've ever done, most challenging 4 years of my life. A lot of it is a blur, but it was also like 4 of the best years of my life.
Some of the most challenging, some of the most rewarding, I'm sure.
Yep, the best of times and the worst of times.
Well, now it's all past you, and you have a bright future to look ahead to. So let's get to these. Questions. So first and foremost, let's begin with the background and early career. So you grew up in Timonium, Maryland, with 4 brothers, and you had a love for playing sports. Have you always known that you wanted to become a dentist? And if not, when did you realize?
I haven't always known. Growing up, I think when I was really little, was probably like wanted to be a pop star or something. But when I really started thinking about careers and like reflecting on my interests and what I might like, I really did have a lot of great experiences at the dentist growing up. I actually had 3 front teeth. So they pulled one of my front teeth. Yeah. And they said, Mom, which 2 are we keeping? Which one's got to go? So pulled that tooth and they put me in braces. And I loved the experience. I loved going in for my checkups, also at my pediatric dentist, just for cleanings. Like I always just felt left feeling confident. And I loved like catching up with the dentist. I felt special when they asked me about my life and they remembered things about me. So it was a great environment. So I think when I got older and started thinking about careers, dentistry was definitely on my mind. But I wasn't quite ready to commit to that yet. I think I had generalized it at that point to I want to do something in healthcare. So that's when I had to take it upon myself to like do the research on these fields. And that's kind of what led me to reach out to some local dentists and led me to Dr. Chinchek, where I did a little internship one summer. And that was like my big introduction to dentistry.
Wow. So really just began with a series of great experiences at your pediatric dentist. Also with 3 front teeth. I'm not a dentist, but I've never heard of it, something like that. How did you know which teeth to pick? Like, was it just your favorite tooth that you decided, your least favorite tooth you decided to remove? Like, how could you pick?
I think it was more my mom's call and the dentist's call. Probably we probably picked the bigger ones. I think one might have been smaller, a little wimpy. I'm not sure if there's a condition called mesiodens, and it's like actually a really tiny little nub of a tooth. I don't know if I had that specifically, but it was definitely unique. And I definitely had it significantly improved confidence after my treatment.
No kidding. No kidding. I'm sure had something to do with the two teeth that matched the most in terms of size and color and all that. But
Yeah.
it seems like a lot of um, that great experience was caused by a pediatric dentist that really cared about the relationship with their patients. And I think that a pediatric dentist probably, like a good pediatric dentist probably understands, but kids are so impressionable. And any adult asking them about their lives can really make an impact and really change the trajectory of their life. Like maybe if that dentist hadn't even asked you questions or been curious about your life, maybe you don't become a dentist today.
Maybe. Yeah.
Yeah.
He definitely made me feel special, feel cared for. And I also like there's just specific things like everything about that office was like really enjoyable for me. He always wore a bow tie. He had a specific cologne he would wear. So when he came and checked the hygiene checks, like it was just like very, I don't know, memorable. And yeah, as an impressionable kid, having positive experiences like that, it definitely gave me, green flags for dentistry.
No kidding. Well, that's really, really cool. And you also mentioned that you were a dental intern for Dr. Lynn Chichek, who's my mom. We'll get more into that later as well. And I'm excited to talk about that, of course. So how is your background and upbringing, the way that you were raised by your parents and your background of having four brothers, how has that shaped your perspective on patient care and community involvement?
Yeah. So I think growing up with four brothers definitely shaped me into somebody who values collaboration, values strong relationships with the people around me. Um, and, that's what we all played sports. I was always on a lot of teams. We did field hockey, lacrosse, track, swimming, soccer, everything. So I think I loved being a part of a team. I loved being working together with people, whether that was my teammates or my brothers. Like getting up to trouble together, or trying to figure out what we're going to get our mom for Mother's Day. I loved being in that kind of setting. So I think that kind of led me to be attracted to the profession of dentistry, where I saw, people working together closely in a team. I saw people helping one another, making a difference in people's lives. Dentists making a difference in patients' lives, and making a difference in the community as well. It all kind of stems from that love of a tight knit community and working together towards a common bigger goal.
Yeah. It sounds like you're viewing dentistry as an opportunity to be collaborative, not only with team members, but also with your patients and with the common goal of improving lives.
For sure. Yeah. I totally view the patient as the most important person on the team.
Yeah. Well, that's beautiful. I love that. So for early career experience, your dental career, as we mentioned earlier, began at the practice of Lynch and Check DDS as a dental intern. What did you experience during your time in the practice that has influenced your path to dentistry?
So I think, the biggest takeaways from my experience at Lynch and Check's office was just, being around, seeing dentistry from the dentist perspective. And, because I had always been the patient. And I would often see patients leaving Dr. Chinchek's office, hugging Dr. Chinchek, like smiling, chatting. They, not wanting to get out of the chair because they just want to keep catching up. And um, it really showed me how happy this profession is. I loved the way that people, their moods kind of were uplifted when they left. And I loved, the continuity of care. People coming back every 6 months, at least for cleanings and checkups. You really get to follow someone over the course of their life. And a lot of Dr. Chinchek's patients have been seeing her for so many years and then bringing their kids in. And I just loved that you over time build relationships with patients. And that's was like my biggest takeaway from that experience, honestly, was that this is something I really want to do.
Yeah, no kidding. I mean, I've definitely seen a lot of that as well in my mom's practice. Obviously, I've decided for my career is going forward trying to help dentists like my mom. So obviously, the impression it left on me is similar to you in the sense of how my mom's dentistry and the relationship with her patients seem to carry over so much more than just the dentist-patient relationship. And it's pretty clear that that must be, for at least from the outside, it has to be the most fulfilling part of the entire day.
Yeah, I think dentistry is so fulfilling in that way. Um, and I definitely love seeing, how, her go through the day and working with your hands and solving complex problems, and running a business and being a leader. All of those things were so impressive to me. But at the end of the day, it was those relationships that I saw being forged that really left a strong impact on me.
That's fantastic. Well, Maura, I have a little surprise for you. I have uh, a note from Dr. Chinchek about you, and I would like to read that to you if you're okay with that.
Oh my gosh, yeah, that's
Um,
awesome.
so I asked Dr. Chinchek to give a review based on her interaction with you, her relationship with you, and all of these things. So what Dr. Chinchek said was, I was so impressed with Maura's initiative as a sophomore in college to seek me out for an internship. I had never even considered having an intern, but I got this most compelling email from this young woman. And I thought that as a female dentist, I should be a role model and give her the opportunity to experience the profession. Maura was bright and friendly and an immediate asset. She was eager to learn and happy to help wherever necessary. It was such a mutually beneficial arrangement that I invited her back the following summer. It was after that second experience that she told me that she decided to choose dentistry over medicine for her career. I was so very pleased and now so extremely proud of her accomplishments. Congratulations, Dr. Maura Pezzulla. I wish you all the best in your future Navy experience and hope that you stop by for a hug next time you're in town. I'm crazy proud of you.
Aw, that is so sweet. That really means so much. I need to go stop by and give her a hug right now.
Yeah, she views you in, I would say, the most favorable light. And obviously, my mom is somebody who has very high standards in terms of life, but also in terms of the people that she invites into her professional world. And for her to say how proud she is of you, trust me when I say it is a very, very sincere compliment. So
It means so much. Yeah. I mean, I just have so much respect for her. I think that it's so important to have mentors in your life. And Dr. Chinchek has been like the best mentor to me. And I think it's important that those mentors aren't only someone that you look up to as a professional and as a clinician, but just as a person in life. And Dr. Chinchek was that person for me. Like I could just look up to her in every aspect of her life. And I would love to, I asked her questions, about dentistry a lot, but also just about her life and how she balances running a successful practice with, having a fulfilling and balanced life too. So it means a lot to have praise from her.
That's beautiful. What inspired you to, well, I guess I know what inspired you, but why did you reach out to Dr. Chinchek? How did you find her practice when you were just a sophomore in college and you were looking for an internship? Didn't know you wanted to become a dentist yet. How did you find her practice and what spoke to you about her practice?
So I reached out to a few different practices in the area, but Dr. Chinchek's office, I think I literally just Googled dentist in Luther Road Timonium.
Yeah.
And yeah, I saw her office, her website, her photo, her bio. It just felt warm. I don't know. She seemed like a really nice person and somebody I could, I wanted to have a woman in dentistry as a mentor for me. But yeah, Dr. Chinchek's website, I don't know, when I Googled dentist near me, it just stood out to me in a way that was, this is going to be a safe place for me to learn and be mentored and help.
Wow. So cool. So cool. And now how full circle this is to be talking to you right now.
Right?
Just out of curiosity, so you mentioned how it was important for you to connect with a female dentist. My mom, when she graduated in the 1980s from dental school, she was one of 3 graduating females of her entire dental class. What was your graduation split, the female to male?
It was more female, and it was significantly more female. I think it was like 65% women
Wow.
in my class, at least.
Wow.
Yeah.
I mean, my mom had a graduating class of about 100. So if we're just doing simple math, 3 out of 100, 3% going up to 65% in obviously a different school, but it just shows the shifting of the industry. What would you say, what would you credit that to, where more females are more interested in joining the dental industry or becoming a dentist more than at times past?
So I think that, you know, there are just more women that are in professional industries now. But on top of that, I think dentistry specifically is attractive to women because it offers, a chance to be a compassionate provider. And like I talked about, build those relationships over time with patients. And it does also offer, and this was something that was really attractive about dentistry to me, was a really nice work-life balance. One thing that I asked Dr. Chinchek when I was thinking about dentistry was how, like, I want to be a mom. How can I do this and still do that as well? And she walks me through her experience raising you and your brother, and how she was able to balance everything. And dentistry, especially if you own your own practice, it offers that kind of flexibility to shape your career and your work-life balance to what's going to work best for you. So I think that dentistry is, for me as a woman, that's something that like really attracted me to dentistry. And I think women are awesome dentists. So there's a lot of them in dental school.
Yep. Makes total sense. And I agree completely. No doubt about it. So moving on to your academic achievements and honors. You had your honors in vulnerable populations. You received your honors in vulnerable populations at the University of Pennsylvania. And according to the UPenn program catalog, I did a little research. This honors program is described as honors in vulnerable populations focused on providing comprehensive care to refugees, survivors of torture, asylum seekers, and survivors of intimate partner violence. Tell me more about what was involved in earning this honors.
Sure. So, in my fourth year of dental school, I started working in this clinic. It was a half a day a week. So Wednesday afternoons, normally I would have Wednesday afternoons off, but I would go to the vulnerable populations clinic and just provide care to those populations that you mentioned. We have a partnership with NSC in Philadelphia. It's Nationality Service Center. And they're the ones that are connecting a lot of those immigrant and refugee populations with medical and dental care, along with, other resources and opportunities. And then, we do treat other populations as well, like survivors of domestic violence. And there is a clinic at Children's Hospital of Pennsylvania that we get referrals from, and they work with sex trafficked youth. So there's a lot of, these vulnerable populations that we're treating. A lot of the patients don't speak English, so we're working with translators. They're basically like iPads on wheels. And so that was there was definitely a learning curve there working with a translator. And I learned how to be a really effective communicator and breaking things down, really making sure that nothing got lost in translation when we were talking about diagnoses and treatment plans with these patients. Something that I really learned in that clinic was how to build over time a really trusting patient-provider relationship. Always had trauma-informed care in mind. So we wanted to make sure the environment was comfortable. We were taking things slowly, asking questions along the way. If you think about it, laying down in a dental chair with somebody just hovering over you, that's a really vulnerable position to be in. A lot of times think about if you have the rubber dam in your mouth or a bite block, you can't close. So we actually strayed away from using a lot of those tools. We were always working with an assistant. So we achieved isolation in other ways, rather than using a rubber dam or things that might make someone feel claustrophobic. But a lot of those patients that we treated, they had very complex dental needs. And their treatment plans were extensive. So a lot of our patients, it took us a full year to finish their care. And some of them are, getting passed on to the next group of students doing this program. So we had to just always be over communicating everything, reestablishing the goals of treatment at the beginning of an appointment, and making sure that the patient was comfortable along the way. It was a really unique experience. I had a lot of patients who were refugees from Afghanistan, Russia, Ukraine, and they had been through a lot. So we had to work to build trust, for sure, in our patient-provider relationships. And it took time, but it was so rewarding at the end to see them achieve their dental goals and restore their oral health and their confidence as well.
That is so cool. I'm just thinking when you're talking about all the different, populations that you saw and the vulnerable people that were sitting in your chair, I agree 100% that, of course, being laid back in a chair and having not just a person hovering over you, but a stranger hovering over you with a mask it's a very intimidating experience, especially for people who've been through a lot. So I can only imagine that from your perspective, you mentioned that due to a lot of the language barrier, as well as the need to communicate, like, and you said over communicate, it's such an interesting balance that I'm hearing of you need to simplify things in your mind so that they could understand it and the translators could understand it. But also you wanted to over communicate so that they felt comfortable and the entire process was crystal clear.
Right.
How I can't imagine what it must have been like to strike that balance. That must have been so difficult.
It was difficult. We would have to, I mean, in dental school, things move a lot slower than in private practice. We would especially take our time out in this clinic. You would, especially in the beginning, set aside 4-hour blocks for one patient. And I remember we would spend with some of our patients up to 30 or 40 minutes in the beginning of the appointment, kind of just talking and re-explaining what we're doing, pulling out the model and pointing at the areas of the mouth we're focusing on, asking questions about their preferences in treatment. And a lot of these things we had already discussed, but we bring them up again because we want to be on the same page at every appointment. You never know when, the translator explains something to them and they're like, okay, yeah, but I don't know what the translator said. So I need to confirm at every step of the way that we're on the same page. So it really was just a matter of slowing everything down.
Wow. Well, in terms of training the future comprehensive dental care dentist, I can't imagine a better exercise than learning how to communicate and over communicate while also simplifying what's being said. What an amazing exercise. What drew you to this program over a more traditional honors program like doing clinical work? What exactly drew you to the vulnerable populations program?
I really wanted just more experience in these patient provider relationships because like I mentioned before, that was something that really drew me to dentistry in the first place was the great example that I had seen of Dr. Chinchek building these strong relationships with her patients. And I felt like I wanted more training in how to be that great dentist that you trust. And that's you're not confused and you feel comfortable. That's the kind of dentist that I want to be. I want to be able to slow down and explain things well and fully. So that was really why I chose that program. Also, the cases that I was seeing were very complex. So I was excited to get more experience in crown and bridge work and removable dentistry. So I did get that experience in the clinic as well.
Wow. So not only from a personal human connection standpoint would it be a greater challenge and greater ability to learn, but also from a technical dental perspective, it has real life, real world implications your dental work does. And the people who are coming in are some of the more extreme real world examples. So in terms of getting a good example in dentistry, I can't imagine anything better.
It was really an awesome program. I hope that other dental students have the opportunity to experience something like it.
Yeah, no doubt about it. Well, hopefully there's some future dental students that are listening to the podcast now and can learn a little bit about the program, and maybe you've been an inspiration to the next generation, which is great. All right, so let's move on to career goals and specializations. So your short-term career goals, Dr. Pezzulla, you're going to be working as a general dentist in the Navy for the next 4 years. What inspired your decision to serve as a general dentist in the Navy? after dental school? And how do you believe this experience will shape your career in dentistry?
Yeah. So when I was applying to dental school um, and realized how much it was going to cost, that's when I started to look around at scholarships. Dental school is really expensive. I think to attend Penn Dental for 4 years, it comes out to close to $500,000.
Wow.
So yeah, it's a lot. So I started looking around at scholarships, and that's when I became aware of the HPSP scholarship. That's the Health Profession Scholarship Program. They have it with the Navy, the Army, and the Air Force. And right off the bat, I was kind of like, this is something I could definitely see myself doing, just off of the research I did and the people that I talked to about it. You get such unique opportunities as a dentist, in the military, to travel abroad and practice abroad, or in the Navy, potentially like do a tour on an aircraft carrier as a dentist or a hospital ship doing humanitarian missions. It was just awesome. I was like, no other dentist gets to do this stuff. Um, and as far as Navy over the other branches, I liked the locations of the bases in the Navy a little bit better. They have, because it's the Navy, it's going to be close to water most likely. So there's bases in Hawaii, Florida, Charleston, Italy, Spain, Japan. Lots of cool places. San Diego is a big one. So that was attractive to me. I also thought their uniforms were a little cooler. And also just being from Maryland, I don't have any family in the military, but just I felt a bit of a connection with the Naval Academy being in Annapolis. And that was why I chose the Navy over the other branches. But as I learned more about the program and about being a military dentist, it became really appealing to me. I mentioned I love being part of a team and collaborating, and the camaraderie that you get as being part of the military is just second to none. And I'm excited about the opportunity to work alongside a lot of people with similar goals as me. I couldn't think of a more deserving patient population. Also, at the end of the day, I am really proud, to serve my country and to help the people who are really serving our country on the front lines and making the ultimate sacrifice, helping them to be healthy. And we call it dental readiness. I don't want anybody to have a toothache out in the battlefield. So we're preventing all of that.
So it's going to be obviously you're just about to start training tomorrow. What kind of cases are you expecting? Is it going to be like a lot of preventative care, a lot of dental cleanings and checkups, or are you expecting there to be some restorative as well?
Yeah, I think it's going to be a mix of everything. So a lot of checkups and restorative work, and then as part of the Navy, they are also focusing on developing you as a dentist. So I will rotate through different specialties and get to work with an endodontist on the base that I'm going to. I'll get to work with an oral surgeon and a periodontist and learn from them as well. The training I'm heading to tomorrow is actually officer development school. So nothing dentistry specific there, but I'm learning basically how to be in the Navy, how to wear the uniform, how to be an officer, be a good leader, learning about naval history. And, there will be some physical testing as well. So I've been working on my push-ups. I never thought that was going to be, part of what being a dentist entailed, but I have to get up to 20 push-ups.
I have no doubt that you will. Wow. That is so amazing. Wow. I love how mission-based you seem to be. how driven you are by the desire to serve others, and just the foresight that you had to see, dental school is extremely expensive. And if this is an appealing way in order to leave dental school with much less debt, it seems like, props to you for having the foresight for looking into that. Just, you don't need to share this information, but I'm just curious. Are you leaving dental school completely debt free?
I am. Yeah,
Wow.
really debt free. They also, so on top of paying all your full tuition, you get a stipend, a monthly stipend, that covers like your living expenses. So yeah, I got out of there debt free, which was amazing. So
Wow.
now, yeah, I owe the Navy 4 years, and who knows, maybe I'll love it so much I want to stay.
Who knows? I mean, the future is in the palm of your hand. So we'll have to see. I can't wait to see it develop. So in terms of specialization interests, you've expressed an interest in endodontics. Can you talk about that interest and what attracts you to this specialization?
Sure. So this is just like an idea in the back of my head. It's kind of like when I started thinking about dentistry. It's like, well, I'm not ready to commit to that yet. But if I were gonna go into a specialty, I think that's what it's gonna be. So endodontics, doing root canals. I've only done the 5 of them. That was the requirement in dental school, and they were pretty easy ones. So I can't say I've had a ton of experience doing root canals, but I did enjoy the 5 that I did. When I think about endodontics, I think I really like the idea of helping somebody immediately be out of pain. Somebody comes to you needing a root canal, they're in a lot of pain. I feel like that's really rewarding to have that immediate relief after that procedure. Um, Also, I do kind of like the idea of being really, really good at one thing, at being at root canals. Endodontists really only do a handful of procedures, um, but they get referred the more challenging cases. Um, General dentists also do root canals, but the endodontists are doing the challenging ones. And I like the idea of, you know, approaching a challenging case and um, being challenged every day in that way. But that's kind of, you know, those are my thoughts in kind of being attracted to endodontics as a specialty. Um, but the beauty of dentistry and also this scholarship that I have is I kind of have 4 years to figure it out. Um, and that could change. So if I want to just be a general dentist, I can still do root canals, but I can do a lot of other stuff too. If I don't want to do any root canals, I can refer all my root canals to the endodontist. But I like the thought that I can really focus on becoming a good general dentist in these next 4 years, and then deciding which direction I want to go from there, whether it's endodontics or cosmetic dentistry, family dentistry. Really, I have a lot of options at this point in time. And there's a lot of different ways that I could do it. Like I could also specialize within the Navy. They have their own endodontics residency, along with their own periodontics residency and oral surgery, among others. So I could specialize with them and then be an endodontist in the Navy. I could do it that way. Also, after I've been in the Navy for 4 years, I am eligible to use the GI Bill. So I could use that to pay for my residency if I were to do it outside of the Navy too.
Wow, that's fantastic. I mean, like I said earlier, I mean, the world is your oyster at this point, and it seems that you have this idea of being, going into endodontics, but you obviously have 4 more years to explore. I like the motivation of providing great relief to patients immediately and having that mental challenge. Um, to achieve that. And I think that I'm really excited to talk to you in 4 years and see exactly where you've landed on. I have no doubt that you might end up here or somewhere else you're really passionate about, regardless.
Me
So,
too.
Dr. Maura, we're going to move on to a new segment here on the PS Dental podcast, and it's called the Rapid Fire This or That.
Okay.
I'm going to give you two options, and I want you to pick your favorite. After I list the two options, due to the delay of the Zoom, I want you to give it maybe 2 seconds, because I know I'm saying rapid fire, but I actually want you to give it 2 seconds or so of between us. So we're going to go on to the rapid fire, this or that. I'm going to give you two options, and I want you to pick your favorite. Sound good?
Sound good. Let's go.
All right. For technique, do you prefer hand scaling or ultrasonic scale?
Ultrasonic, for sure.
Style of practice, urban or rural?
Urban.
Digital versus analog, digital or traditional impressions?
Digital.
3D printing for crowns or traditional lab fabricated crowns?
3D printing.
Styles of practice, general or specialized? That's going to be a tough one for you right now.
Yeah, it's tough for me right now. I'm going to say general for now.
Clinical techniques, laser dentistry or traditional drill?
Traditional drill. Haven't really done laser dentistry, so I can't speak to that. Not a pen.
Fair enough. Work environment, solo practice or partnership?
Partnership.
Back to the collaboration. Last one, continued education, in-person workshops or online courses?
In person, for sure.
Okay, very good. And that is the conclusion of our debut rapid fire, this or that. Thank you for participating.
Woohoo!
I've just got a couple more things left for you here, Dr. Maura. I labeled this section as questions from elders, where older, more experienced dentists who have not been in dental school for a long time were curious about what is the current dental school experience like. So the first topic is traditional techniques. Do dental students still set denture teeth?
Yes, we do. I set 5 arches of complete dentures and 3 arches of partial dentures. So unfortunately, we do still do that.
Unfortunately.
I hope to never set teeth again.
Okay. Do dental students still wax and cast their patients' gold crowns?
No. No, we don't. Not at Penn.
Best. All right. Those were my questions from elders.
Okay.
I may need to work with the name because elders seems a little bit outdated and a little bit offensive potentially. Let's just say
I like it. From the wise elders.
Okay. Well, good. I'm glad that you like it. We'll see how they feel about it when this debuts.
If anybody's wondering, we also don't really do amalgams. We learned them, but we didn't really do them any.
Okay.
And no gold foils or gold onlays.
Okay. So you learned about it, but you didn't need to complete it in order to move forward.
Yeah. Yeah.
All right. Very good. Last question. This is more of a reflective, future-focused question for you. If you could speak to Dr. Maura 15 years into her career, what would you want to ask her?
Oh, this is a tough one. I would ask her, was it as scary as you thought it was going to be? Being a new dentist and, did everything end up working out like you thought it would? I think with the military, I'm such a planner. I've always wanted to have the 5-year plan, 10-year plan. And I kind of just have had to become this go with the flow person because I'm going to move around a little bit. So just, was it as scary as you thought it was going to be? And did it end up all working out like everybody said it would?
That is beautiful. I can't wait to play this for you 15 years into the future. But Dr. Maura Pezzulla, thank you so much for joining us on the PS Dental Podcast. Congratulations on your graduation. And we cannot wait to keep up with you as you go through your next 4 years in the Navy. Thank you so much for coming.
Thank you so much for having me. It was great.